Good day everyone, my name is Krisha Estrada and I'm going to present measles, also known as rubeola. So here is the definition. Measles is an acute, contagious and exanthematous disease that usually affects children who are susceptible to upper respiratory tract infection. This may be one of the most common and most serious of all childhood disease. The causative agent. A filtrable virus which belongs to the genus Morbillivirus of the family Paramyxoviridae is the agent of measles. Mode of transmission. The disease is transmitted through direct contact with droplets spread through coughing or sneezing. It can also be transmitted indirectly through articles or fomites freshly contaminated with respiratory secretions of infected patients. Here is incubation period. It is from 10 to 12 days. The longest is 20 days and the shortest is 8 days, and a single attack conveys lifelong immunity. Period of communicability. Measles usually last about 9 to 10 days, measured from beginning of the prodromal symptoms to the fading of the rash. The disease is communicable 4 days before and 5 days after the appearance of rashes. And take note, the disease is most communicable at height of rash. So next, we have the sources of infection. The virus has been found in patients' blood, as well as in the secretions from the eyes, nose, and throat. Measles can be very easily spread from person to person. So here is the pathophysiology of measles. It is caused by paramyxovirus and is a human disease with no known animal reservoir or asymptomatic carrier state. It is extremely communicable. The secondary attack is greater than 90% among susceptible people who are exposed. So first, the virus will enter the body through nose or mouth, and the inoculation and replication in respiratory tract and immune cells will start. Number 2 is the spread in lymphatic, so there is a cell-to-cell transmission. Number 3, the virus is already in blood. And number 4, the common symptoms may rise, such as fever, cough, coryza or runny nose, conjunctivitis, macupapular rash. It is infected endothelial cells plus T cell response. So you can have your complex spots in your mouth. And 5, recovery with immunity. Clinical manifestation. In pre-eruptive stage, you may experience fever, catarrhal symptoms such as rhinitis, conjunctivitis, photophobia, and coryza. Respiratory symptoms starts from common cold to persistent coughing, and you also experience enantian signs like complex spots and Stimson's line. Here is the eruptive stage. A macupapular rash usually starts to appear late on the 4th day. The rash appears first on the cheeks, bridge of the nose, temples, earlobes, or along the hairline. The rash is fully developed by the end of the 2nd day, and all symptoms are at their most severe at this time. High-grade fever comes on and off, anorexia and irritability, abdominal tympanism, pruritus, and lethargy. The throat is red and often extremely sore. As fever subsides, coughing may diminish, but more often it hangs on for a week or 2 and becomes looser and less. So here is the last stage in clinical manifestation of measles. Stage of convalescence. The rashes fades away in the same manner as they erupted. The fever subsides as rashes start to fade. When the rashes have faded, desquamation begins, and the symptoms subside and the appetite is restored. So here is the clinical features. Here is the diagnostic test for measles. We have nose and throat swab, urinalysis, blood exams like CBC, leukopenia, leukocytosis, and hemagglutinin tests. So next is treatment modalities. We have antiviral drugs like isoprenosin, antibiotics if with complication, and supportive therapy. Nursing management. Isolation of the patient is necessary, so the room must be quiet, well ventilated, and must have subdued light. Control the patient's high temperature with warm or tepid sponges. Skincare is of utmost importance, so the patient should have daily cleansing bed bath. The water should be comfortably warm. Oral and nasal hygiene is very important. Care of eyes is necessary. The patient is sensitive to the light, therefore position the patient in such way that direct glare of light is avoided. Care of the ears is also important, so the responsibility of the nurse is to be alert for any signs of early mastoid infection. Next is daily elimination. This can be accomplished with mild laxative as prescribed by physician. During febrile stage, limit the diet to fruit juices, milk, and water. If the patient is vomiting, give frequent small servings of ice juices. The patient's position should be changed every 3 to 4 hours, and penicillin or other prescribed medications are usually given in cases where there is complication. So here is the common nursing diagnosis for measles: ineffective airway clearance, altered nutrition, less than the body requirement, impaired skin integrity, activity intolerance, knowledge deficit, body image disturbance, alteration in comfort, sleep pattern disturbance, and altered body temperature. So here is the prevention and control for measles. Immunization with anti-measles at the age of 9 months as a single dose. The first dose of measles, mumps, rubella or MMR vaccine is given at 15 months old, with the second dose at 11 to 12 years. The measles vaccine should not be given to pregnant women or to persons with active tuberculosis, leukemia, or lymphoma. Next is pathognomonic sign of measles. You can see Koplik spots in your mouth. Thank you for listening.